Hello everyone, welcome back to Make Skills Practice. In today's video, I am going to take you through how to identify the common reason why you are always failing to perform pediatric IV insertion technique. In this video, I am going to show you the common reason why you fail to identify and perform pediatric IV insertion technique. And this skill is very essential skill for nurses, doctors, and healthcare professionals for sharpening their skills in mastering pediatric IV insertion technique. So I will show you common mistakes or common reason why you are failing to perform pediatric IV insertion technique. Before you start, make sure you gather all the necessary supplies that you need to perform the procedure. Then first make sure you place the child in appropriate position. Then you get the child's hand. First make sure you apply a tourniquet. Make sure you apply a tourniquet. Then you have to do proper retraction of the skin. Make sure you have to retract back the skin for the vein to be visible for you. So this is the common reason why you're always failing for you to perform pediatric IV cannulation. This is because if you don't retract back the skin, the vein will not be very visible for you to insert the IV insertion, and you will miss the direction of the vein. When you insert the cannula into the vein, you may miss the right direction for you to follow of the vein. You may miss the direction of the vein for you to follow straightly. So this is the common reason why you're always failing to perform IV insertion technique, is not retracting well back the skin for the vein to be visible and intact for you for easier placement of the IV insertion. Number two mistake is not selecting the right size of the cannula. So 24 gauge cannula, the yellow one, is the preferred IV insertion size for pediatric patients. Make sure you select the right and appropriate size of IV cannulation. Another mistake is when you insert the IV cannula into the vein, not following the right direction of the vein when you insert the IV cannulation. So these are the main mistakes why you are failing to identify and perform pediatric IV insertion technique. First, make sure you get an alcohol swabs. First, you clean the vein with an alcohol swabs. Make sure you clean the vein first with an alcohol swabs. Then allow the skin to dry for some time. So another mistake you are supposed to avoid is inserting the IV cannulation an area where two valves meet. So you have to avoid inserting the IV cannulation an angle where two veins meet. So you have to avoid that. Then you get the IV cannulation. Make sure you unpack the cannula from its packaging. Then you attach the cannula in position for flexibility. Then make sure you remove the cap of the cannula. You get the child's hand. Make sure you use your non-dominant hand, that is the left hand, and your thumb will always there for you to support you when you are performing the IV insertion, because it will help you to retract back the skin for easier placement of the IV insertion. So here we go. This is how you are going to perform. Make sure first you retract back the skin. Make sure you retract back the skin. So this is how you are going to perform pediatric IV insertion. Super. You can see there is a flashback in the jump of the cannula. So you slightly pull back the needle. Then there is a secondary flashback. Then you advance the cannula deep into the vein. You release the tourniquet. Then you completely remove the needle from the cannula. Make sure you cap the cannula. Then you start dressing the cannula now. When you finish, make sure you dress and secure the cannula. You get an adhesive tape. Make sure you dress the cannula. So this is how you are going to dress and secure the cannula. Then finally, you get sterile water for injection. You flush the cannula. You remove the cap of the needle from the syringe. Make sure you apply pressure to control bleeding. Then you remove the cap of the cannula. So this is how you are going to flush the cannula. You put the syringe into the opening of the cannula. Then you push the plunger for you to flush the cannula. So this is how you are going to perform pediatric IV insertion technique. When you finish, make sure you apply pressure on the tip of the vein to control bleeding. You remove the syringe from the cannula. Make sure you cap the cannula. So this is how you are going to perform pediatric IV insertion technique. I hope you find the video very helpful. So please don't forget to subscribe, like and share, and give your comment to this video. Thanks for your watching. See you in the next video.